Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Have a day. Welcome back to Healthy Living. Heart palpitations are when the heart beats hard and fast. It's normal to hear or feel your heart pounding as it beats faster when you exercise or do other physical activities. But if you have palpitations, you might feel your heart pounding while you're just sitting still or moving slowly. Joining me now to tell us more about what causes these palpitations and how it can be treated is Express Care's Dr. Jitka Lom. Thanks, Doc, for coming in. Now, what are heart palpitations and what causes them?
Okay. Well, you know, in one day, Mindy, our heart will beat about 100,000 times or more, and we really won't be aware of it. It's just silently doing its job, and we're doing whatever else we're doing. And then if we become aware of our heartbeat, that's often because of a palpitation, which we might experience as a skipped beat or as a sudden pounding, like you said, in the chest, or just an awareness of feeling our heart beating. And then people call that palpitations, and they get concerned because normally we don't feel our heart at all.
Right. So now, when is it serious enough for someone to say, okay, I think I need to go to the doctor? I mean, yeah. I think it's normal when you exert yourself a little bit, you're going to feel your heart pounding a little bit
Definitely.
More than normal, which is good.
Which is good, which we want. Yeah, exactly. So the concern is if it's an irregular heartbeat, most of us probably know how to take our pulse, and you can check and see if your pulse is nice and regular. And if the beat is irregular, or if you're having skip beats, especially if they're causing weakness, dizziness, shortness of breath, or even chest pain, then those can be dangerous arrhythmias, and that just means a dangerous type of heart rhythm.
Okay, so how does a physician evaluate a palpitation, or I guess monitor your heartbeats?
Yes. So first we listen and hear, okay, are there any of those dangerous warning signs like the weakness, dizziness, loss of consciousness, or fainting spells, or chest pain? And if those are present, then we need to really look into it. But the way we test is to do an electrocardiogram, which is an EKG, basically an electrical test of your heart. Which doesn't hurt at all. And then other times we'll set the person up for what's called a Holter monitor, where they wear a monitor like that all day long to see how is their heartbeat, because sometimes when you do just a simple EKG, they're not having the palpitation at that time. So they have to wear it for 24 hours and see if they pick it up. Sometimes even then you don't pick it up, so they wear it for a whole week. But eventually you'll pick up the rhythm on the strip to see what is the heart actually doing during that skip beat.
So does this mean that there's something wrong with your heart, if this is, the case?
Sometimes there is and sometimes there isn't. Let me give you a couple examples. So with something called mitral valve prolapse, which many, many people have, it's a totally benign condition, meaning a condition that will not hurt you at all. It's when one of the valves in the heart is a little tiny bit leaky, not in a way that's dangerous to you. But with that, sometimes people will feel their heart or feel a skip beat. And so we can pick that up on the EKG, and also something called an echocardiogram, which is a sound wave, like an ultrasound test of your heart. You can see the heart beating, and then you can tell the person that's nothing to worry about. But other times, somebody will flip into a more dangerous rhythm where their heart's going very, very quickly and irregularly. An example would be, for example, atrial fibrillation, where the top chamber of the heart, the atria, are going crazy, and they're just kind of doing their own thing, and they're not coordinated with the ventricles. And then that one's dangerous because it's kind of like a shaking motion, and as the atria do that, they can build up a clot. And then the clot can break off and go up and cause a stroke. So these are different, very, very different conditions, might cause totally different symptoms, but they are palpitations.
So if someone is experiencing this, they go to the doctor, then how do you treat this?
Right, so it really depends on what the rhythm is, and without the special test, you really can't tell. You often can't tell by testing their pulse or even listening to their heart. So you have to do those tests, and then you can determine. Sometimes they have to see a specialist, a cardiologist. But the treatment of a simple arrhythmia, meaning like it's nothing to worry about, is just reassurance and lifestyle, like try not to drink so much coffee, or don't stress out so much, or don't drink that cough syrup, or a medication adjustment. And for other arrhythmias that are more dangerous, we might take medication every day to prevent them, or sometimes if they're very severe, the person might need a pacemaker.
Okay.
So,
now, are there some drugs or even foods that can cause palpitations?
Yes, there are. Caffeine's a top one. As far as other drugs, certainly illegal drugs like ice and cocaine will give people some bad palpitations. As far as other medication, oftentimes a simple thing like cough syrup or Sudafed might give people a little bit of a jolt in their heart. And food-wise, I can't think of any other ones that might do that.
Like high sugar?
Oh, I guess if you're sensitive and you're maybe even when you go hypoglycemic and then have a bunch of sugar, you could do that maybe.
All right, sounds good. Well, we have to take a quick break, but we will pick up our discussion when Healthy Living returns, including your questions in just a moment.